I didn't really realize I felt like I had had enough. And I remember being in bed that night and thinking, I'm ready to book a flight and disappear and not tell anybody where I'm going. I don't want anybody to find me. Or I'm ready to head up to the last floor of the building and jump off. Like I was suicidal. And that's when I realized, okay, I'm obviously not okay. And this is exactly the time that I need to find some help and some professional help. Hi, guys. Welcome back to another episode of the Madinat Mom Podcast. I'm Nour, your host, and today's guest, Sarah Melki, is a functional medicine health coach and an integrative health practitioner. She runs her own health coaching practice, and she's also co founder of Raising Health 101, which is a platform that provides parents with tools and education to help them navigate all kinds of children ailments. Sarah is a mom herself, and after becoming a mom, she expanded her expertise to pediatric specific functional medicine training so that she's able to better understand children's health from an integrative perspective. Sarah is here today to talk about her motherhood journey and also provide some of those valuable tips and tools for parents that we all need ahead of that flu season. So make sure to stay tuned because you don't want to miss a thing. Thank you for being here. Thank you for having me. How are you doing? I'm doing great. I'm really happy to be here and see you. Me too. I feel like I was just telling you, but I feel like this episode just had to happen, right? Like we've been talking for a while. We've been trying to make it happen. We randomly met for coffee in Lebanon over the summer and now we're here. So thank you for making the time and for coming on this podcast. I'm so excited to have you and I'm so excited to dive into all of the goodness of today's. But before we get into business, let's talk motherhood a little bit, right? Tell us a little bit about how was your transition into motherhood? How was that like for you? Um, it's an interesting question. I would say it may be a little bit different than most people. I actually never imagined myself a mother. I wasn't sure if I wanted to have children, and my daughter Sophia came as a surprise. She wasn't planned. Um, and honestly, motherhood was and still is tough for me. It's not something that I find comes to me very naturally. It's not something I find um, that I necessarily enjoy the way other moms do, which, you know, over time, I've learned to accept and embrace that part of myself and tell myself, like, that's okay. But it was definitely a long road to getting to that place where I've accepted that. I've accepted that I'm, not like many other moms where, I have kids. It's a social norm to have kids, I guess. But it wasn't something that was for me. Mhm. And Sophia is 7 now. Yeah, she turned 7 in 2 months. So how long do you think it took you to actually be comfortable with motherhood? I don't know that I necessarily ever really became comfortable, but it just became a part of life that I got used to. Um, I think the hardest was obviously the first few years. The first year, especially, of course, having had postpartum anxiety. Um, I was extremely, extremely lost. Um, I definitely felt kind of, I don't want to say regret because I'm so thankful for my daughter. I'm so thankful I have her. But I clearly didn't feel ready. I wasn't ready to take on motherhood. I wasn't ready to let go of my life before her, if that makes sense. Mm. You know? That's amazing that you're so open and honest about that. Can I ask a little bit more about your reaction when you found out that you were pregnant, knowing that it wasn't something that was in the plans for you? Yeah. it's funny because my husband had been sort of at the time was like pushing, all right, we've been married for 2 years. Let's take the next step. And I remember I really kept chickening out and I kept saying, you know what, let's wait, let's wait, let's wait. Um, and then honestly, obviously it was meant to be because it happened. My reaction was, yeah, it was a very big surprise. I mean, I think, I had told you about this briefly, but I had just come out of an eating disorder that I struggled with for 5 years. So after 5 years, well, feeling like I lost 5 years of my life, I felt like myself again. And I wasn't really prepared to lose myself again, if that makes sense. Um, I was in a phase where I really just wanted to uh, sort of rebuild that relationship with myself. And instead, I found myself feeling like, okay, now I have to build a relationship with someone else that I don't even know that's growing inside of me, And so I think it was not, I was, and it's a little bit difficult because I do know that many women, and I had clients that had difficulty getting pregnant, and many women at this, in today's world have difficulty. Fertility issues are huge today, so it felt like I couldn't speak about it. I didn't feel like it was fair to speak about it. I felt like I was being ungrateful. I felt like this is God's plan, and I'm being ungrateful for God's plan. So yeah, there was a lot of mixed emotions, kind of being angry at myself for not being grateful, but at the same time feeling like, no, I deserved that time to myself. I had just, come out of whatever it was, and I deserved that time to sort of rediscover myself. And now I felt like I wasn't really getting that. So yeah, it was hard. It was hard.
Yeah, I think, we get that a lot on say Hamdulillah, right? Which sort of undermines your personal experience, how you're feeling. And so I completely get that. But getting to a point where you understood sort of what was going on and you understood that the journey you're on is something that is difficult for you, I think takes a lot of courage. And not being able to vocalize it is a shame. And that's something we're trying to change as well through these discussions because it is how you're feeling and nobody can take that away from you. It's how you're feeling and it's valid, right? And postpartum is also very difficult. You go through a lot of identity loss. You feel like you don't know yourself. You are still trying to recover, but at the same time, you're trying to keep this little human alive. And so I get that. And you touched a bit on postpartum anxiety. Can you tell us a bit more about how was that for you?
Yeah, so previous previously due to my eating disorder, I did have experience with depression, and a lot of my focus during pregnancy was, preparing myself for kind of um the possibility of having postpartum depression. Like for me that was very likely. I think they say, I don't remember what the percentage was, but if you've experienced depression in your life, you have a much higher chance of experiencing postpartum depression. So I was mentally preparing for postpartum depression. I was mentally preparing for that, and kind of, I don't find it as like something negative to prepare for postpartum depression. I felt like actually it felt empowering that I had this information and I could be prepared for something like that. What I didn't expect was that I did not have any postpartum depression. I had postpartum anxiety. And for someone who had never experienced anxiety in general, it felt, well, first of all, I didn't recognize it. I didn't recognize that it was anxiety. It was, uh, I mean, I ended up recognizing it. Really, it started with, first of all, I became extremely controlling over almost every aspect of, Sophia's routine, my daughter's routine, when it came to feeding and sleeping. And I became extremely rigid. Um, I wasn't eating well. I was losing a lot of weight. Um, I was definitely not okay, and I could clear I didn't think I was not okay, right? When you're an Energizer bunny, you're running on this, like, these well, what I now understand is anxiety. Your cortisol is pumping 24/7. You don't really notice that there's something that's not right. And my concern wasn't the opinion of my husband or my mother or the people that loved me. My concern was my daughter. So it's like I knew best. I knew it was I felt funny enough. I just felt like this is the right way and this is what I'm doing. Clearly I put a lot of pressure on myself, and I honestly can't believe I got to it was 11 months postpartum when I realized well, I didn't really realize. I felt like I had had enough, and I remember being in bed that night and thinking I'm ready to book a flight and disappear and not tell anybody where I'm going. I don't want anybody to find me. Or I'm ready to head up to the last floor of the building and jump off. Like I was suicidal. And that's when I realized, okay, I'm obviously not okay. And this is exactly the time that I need to find some help and some professional help. And that's what I did. I realized, I mean, honestly, what kept me from doing either of those two things was the fact that I loved her so much. You know what I mean? It's crazy because I wasn't thinking about anybody else. It's like this thing that came into my life, this this child that came into my life is the reason that I feel so bad, but at the same time, I never had the baby blues, or I never had this, like, I immediately felt this immense and overpowering type of love and connection with her despite 24/7 wishing I had my old life. It's such a I don't even know how to put it into words. It's such a weird feeling that it's really hard to say it out loud because it feels like it doesn't make sense. You know what I mean? Like, how can those two things make sense at the same time? But they do. You can really struggle and miss your old life, but also really, really love and want to take care and do everything right for your child?
I think that's motherhood, right? I think it's just you're overpowered by a sense of love
Yeah.
that it keeps you going. And ultimately that's beautiful, but also it's difficult because you don't stop. You don't stop to take care of yourself. You don't stop to ask for help. You don't stop to recognize that you also need to fill your own cup, right? In order to continue giving this little girl. But thank you for sharing that. Thank you for your bravery. Honestly, I can't imagine what that must have been like for you. Um, but at what point did you, because you said that you did seek support, right? You did
Yeah.
help. At what point did you do that? Was that at 11 months when you were?
That was at 11 months. I realized really it was just I was desperate. It was desperation. And I realized that I needed to be on medication. I immediately went and I saw a psychiatrist. I got on medication, and that helped immensely. It doesn't turn you into a different person. I was still my controlling, rigid, you know, type A, and I am that type of person by nature. That is my nature. But um, it definitely leveled me out. Um, which, at the end of the day, like, I look back and I see, like, how far I pushed myself, and I think to myself, "This obviously wasn't the right thing for me to do for me or for her." You know what I mean? But again, it's back to what you said, this is motherhood. We put so much pressure on ourselves, and we push ourselves, I mean, far beyond our limitations sometimes because we think that's what's best for our children. So I was definitely not taking care of myself, and I think I still struggle with that, and I think that's kind of the message out of all of this, or like the moral of the story is take care of yourself as a mother. You know what I mean? Because you have to put your own oxygen mask on first.
Mhm. And looking back now, do you think you should have gotten support much earlier on?
100%.
Yeah.
Yeah, I should have gotten support. The real dip happened after I stopped. I couldn't physically breastfeed. I was pumping. That also was like a whole other issue in and of itself. Um, I was pumping for a newborn child for 5 months because I couldn't regulate. I had some issues with overproduction and a lot of inflammation in that lymph area I couldn't clear properly. But I pushed myself despite knowing it probably wasn't the right thing for me health wise. And then when I did, uh, when I did stop pumping, I remember I felt an immense hormonal change. I think they say once you stop breastfeeding, you do go through kind of this like really sensitive period where you could go into like either postpartum depression or anxiety, and that really was where things like I guess kind of went up a notch in my anxiety. So so yeah, obviously a lot of it was hormonal, but I think, clearly I should have definitely tried to seek help earlier.
So you come from a health background.
Yeah.
Do you feel like that played a role in how much pressure you put on yourself to breastfeed?
Unfortunately, 100%. I mean, part of it was as much as it's funny, I'm not I was never someone who loved to be around children or like children. I had, when a lot of my friends had kids, I felt like, okay, well, I'm not going to be seeing them very often. I didn't like to be around kids. I didn't have the patience for children. But the one thing I really was looking forward to was the breastfeeding. I felt like it's such a beautiful bonding and connection with your child. Um, so maybe there was a little bit of feeling. There was a lot of also pushing myself in the sense I also had a lot of people who would say, "Oh, breastfeeding is a matter of time. Like you have to persevere, you have to push through, and it'll work out." And I kept kind of waiting for that day for it to work out, but it never did in my case because of my individual circumstances. And this is again this is a message health wise where I feel like bio individuality is something that we miss on when we talk even about postpartum and motherhood. We pressure parents to breastfeed, and I always say, obviously being breastfed is best, but at the end of the day, we really need to look at our mental health because I think that's really important. But I you are 100% right in that my health background was a lot of the reason why I pushed myself to the degree that I did. I imagine myself breastfeeding for up to at least a year, and I barely got to 6 months.
Breastfeeding is a lot on the mom. And I think, as you said, we ultimately fed is best, right? And we need to look at the situation as a whole. And if it is affecting you in a certain way where it's draining you, that you're not able to be that mom that you want to be for your little one, then ultimately it's better to look at other options, and it's okay, right? I do want to take a moment to ask you, what is something that you would say to a mom that might be having suicidal thoughts? Because unfortunately in our society we don't talk about it a lot, right? Specifically in the region, in the Arab region, it's not something we openly say. We're not, even to our friends, even to our family, we find it hard to admit that we need that kind of help, and we find it hard to say we're having these kind of thoughts, right? Because of the judgment that we get. So for the moms that are listening that might be going through postpartum and might be having these kind of thoughts, what is something that you would say to them?
Um, I think mostly don't wait. I think as first time moms, uh, we always think we can do everything ourselves. And I think we want to do everything ourselves, right? I feel like it's almost like we're trying to prove ourselves. We can be this super mom, but there is nothing to be proud of in terms of trying to be a super mom. And I realized that I tried to do everything myself. I didn't let anyone near her that wasn't family. And even then, I was extremely controlling. So, I mean, don't wait. Don't wait. It is so okay. It is recommended to reach out for help. It does not make you a weak person, although that is what I felt. It is what I felt. And I probably wasn't able to rationalize that feeling at the time. But yeah, the message is it is okay to get help.
Yeah.
Yeah.
Yeah, it takes a village.
Takes a village, exactly.
And I think growing up, we were surrounded with this idea that the woman, to be worthy, right, of motherhood, needs to be able to do everything on her own, cook, clean, take care of the kids, and these days probably even work. But that's not the case. Like, it really takes a village to raise kids. Even if you have one person by your side and you're able to lean on that one person, that makes the world of a difference.
It really, really does.
So 100% don't try to do things on your own, because it will just drain you.
It'll backfire.
It will backfire. Yeah, definitely.
For you, and I mean, and that's the other part of it. The other part of it is knowing that as an anxious mom, you are, first of all, she was probably getting that through my breast milk. You know what I mean? And that energy, that's exactly what they feel. They feel your energy because they're close to us. They're on us. They can't speak yet. We can't speak to them yet. They really feel our energy. And that is something, looking back, I feel bad about it, of course.
But babe, I think that's also a lot of pressure on the mom, because you're told that you have to feel a certain way, you have to eat a certain way, you have to rest, you have to, because we need our milk to be good,
Exactly.
But that's a lot of, like, you're telling someone, don't feel anxious and don't feel upset. That's not realistic of it.
It's not. Yeah.
This is the way it is, especially postpartum. Like,
Yeah.
I'm breastfeeding right now. I'm breastfeeding my son. I love breastfeeding him. I think we're enjoying it this time around. But also sometimes when I feel anxious or when I feel stressed or when I feel sad, I try to so quickly snap out of it, because I'm like, how is that going to affect my breast milk? But then I need to really remind myself that I'm human, right? These are emotions that every single person is going to get. And we're already just being there for them, giving them that love, giving them that presence that counts, and that is so important.
100%.
Do you think that was the turning point for you at 11 months?
Yes, somewhat. I think maybe 3 or 4 months later, it was COVID. So while a lot of people were struggling with COVID, I was really happy. I was really happy because we were in a controlled environment. It was, I know it's funny to say, but it was heaven for me. Like we were forced to stay at home. Um, I could control everything at home. There was no pressure to leave the house. There was no pressure to have her nap outside of the house. There was no pressure to feed her outside of the house. So, yeah, it was a turning point for me, and was kind of thankful for COVID because it kind of gave me that really good transition at that. And I think that 1 year old, it's a huge milestone for the parent. It's like, okay, I've kept this child alive for a year. I did it. You know what I mean? I mean, at least I felt that way when she turned 1 years old. I'm like, okay, I did it. I did it. I did 1 year, and things. I'm okay, and she's okay, and everything is okay. So that was definitely a big turning point for me. I think I slowly, with time, it took time for sure. Um, I learned to take it a little bit easier. Yeah.
I'm so proud of you,
Thank
honestly.
you.
Yeah. And I always say that first birthday, that's a celebration for mom. Like, the baby's not gonna know what's going on, but the mom, as you said, you're like, oh my God, like, I did it. I reached 1 year, and that's a huge milestone as well for mom. Sarah, thank you for sharing everything that you've shared so far. And this actually leads me to my next question. You have one daughter.
Yeah.
Is there a reason why you decided to stop at one?
Um, yes. Yes, I'm very much one and done. Um,
it took me I think it took me 3 years, 2 years of therapy to realize, accept, and really be okay with that. Um, you know, the when I had my daughter, it was a no-brainer, like I was I was in the mindset that once you have a child, you have the next one 2 or 3 years later. It wasn't something I even questioned because that is what felt like was the norm, especially in our culture. And until today, I still experience, you know, almost everybody I meet who asks me if I'm going to have another. And when I say I'm not, that, oh, haram, you're really, like it's for her. You should do it for her. Um, but deep down inside, I remember I had planned, 2 years after I have my daughter, that's when I'm going to start trying for a second. And the 2 year mark came and I started to panic. I started to really, really panic. And I remember I was in therapy at the time and I'd go in and come into therapy and I remember eventually at some point, with discussing everything I was feeling and experiencing, I remember my therapist telling me, it's okay to only have one child. It's okay to have no children. And it was like, I don't even know how to describe. It was like a literal light bulb in my brain that was like, wait, it's okay to only have one child? It was something that never even crossed my mind because of this pressure of like, you have to have a second child. You you're literally messing up your child if you do not have another child. And obviously, haram. Exactly. Haram. It's for her. But what's for me? What if it's not okay for me? What if I am doing something purely for her? And this is where I realized, I kind of pieced the whole thing together. That if I was to go ahead and have a second child, um, I was not going to be a good mother. I was not going to be good to myself. I was not going to be good to my husband, my parents, my family. And most importantly, I was not going to be good to my kids. So it was very clear to me that one child was my maximum capability, was my limit. That's my limit, you know? And I, it's not to say that of course I feel bad sometimes. Of course I feel like, is she missing out? And I question myself. But I also really, truly deep down believe that unless I make her feel that way, if I make her feel like, there's an abundance, if then she's going to feel that life is great. Life is great at one child. She gets everything she needs, everything she wants. She gets her parents' full attention. Um, we're happy as parents. We're not stressed out. Um, but if I come at it from this angle of feeling like there's something missing, there's always something missing, then yeah, she's going to grow up to feel like there's always something missing, that she's missing out on a sibling. So that was really, really important for me that when I realized that this was my capability, one child is my capability, and I can be the best mom I could possibly be in this situation with this just one child. That's when I realized I need to make our lives feel full. This is full. We are full at three, at mom, dad, and child. And I think that has made the biggest difference. Again, not to say it's not hard. I think I was telling you this summer, I really felt like, she's 6 turning 7 in a couple of months, and children actually do start to find that their friends, feel like their friends are very important to them. They like to socialize a lot more. They like to be around kids their age a lot more. It's social development. It's completely normal. It was definitely, I felt like, okay, I get it now, how a lot of parents will say this is why one child is hard, because I constantly have to feel I have to find something for her to do or people to see or other kids to see or engage her in activities. Although she's very okay, especially when she was younger, with doing things completely on her own for hours on end. But yeah, that I I'm very much one and done and no longer ashamed. Um, and we're very happy.
Mhm. Yeah, I don't think it's ever something to be ashamed of, honestly. I think life is just everything has pros and cons, right? Everything. Having one child will always have pros and cons. Having more than one will always have pros and cons. And it's just, as you said, it's just presenting it with the pros, right? And presenting it like this is okay. And we grew up with so much pressure. We grew up with the pressure of you have to do this a certain way. You have to have more than one kid. You have to breastfeed. You have to. That pressure bottles up on us and we believe it, right? But ultimately, we getting to a point where you decide what is okay for you, for your family, for your life, that takes a lot of courage. So again, like I think we wanted to have this episode to talk about health and you know everything we mentioned in the intro, but I just couldn't not touch on your motherhood journey because we've talked about it. I know like everything we've talked about now, but it's so impressive and it takes so much courage. And I really hope that someone listening can actually be like, okay, maybe I'm one and done, and that's okay. Or okay, maybe I don't want to breastfeed. Or okay, maybe I want to seek support. I'm not okay. All of these things are very normal in motherhood. So thank you for being so open, for being so vulnerable, and for sharing everything that you did. And I think now we can move on to potentially what might be part two, because I feel like this was such a full episode that we might actually have it on its own. But now we're going to move into, a little bit more about everything that parents are dying to know because it's flu season, Sarah. Like our kids are always getting sick. What is happening? So stick around because we're going to be talking more about that. Let's start by, I think, understanding a little bit more what is functional medicine, and how did you get into it?
I got into functional medicine. Well, actually, my if you listen to episode the first part of this, I talked about having an eating disorder, and that was kind of my entryway into health, kind of. I was always very interested in mental health. I also started to connect it a little bit more to physical health. Around that time, I did a program called IIN, Institute for Integrative Nutrition. As I went through that program, which really, really helped me a lot mentally and emotionally, I realized I was just scratching the surface. Um, and I think this was around the time that functional medicine was really picking up speed. And I went ahead and did something called functional medicine health coaching through IFM, the Institute for Functional Medicine. And I loved it. I loved the idea of looking at the root cause of people's, you know, chronic illness or illness in general, rather than just treating symptoms with medication. Like, if there's a root cause, let's discover that. And what's so amazing about functional medicine, and I mean, integrative health, so many words for it nowadays, but really looking at every aspect of the person's life s- pre-conception. So, whether it's an adult or a child, we're looking at the health of their mother and their father. We're looking at how they were born. Were they born naturally? Or were they born C-section? And all of these little pieces are clues to the bigger picture of what's going on and helps us really get to the root cause of whatever a person is experiencing. So, yeah.
Do you really go that far back into how the person was born? Wow, that's impressive. Okay, and why do you think it's so important to actually like connect all the dots to be able to get to the root cause?
We now know that we pass things, maternally. I think, what is it? I think, first of all, the majority of children's mitochondria are from their mom. So the health of the mother is extremely important. The health of the father is extremely important. I mean, that's why
right now we've started to look at fertility through a very different lens of there's a period of time pre-conception to start working on your health to, you know, really, really be prepared, both mother and baby, for optimal health. So yeah, we're looking, obviously genetics play a factor, but I think the majority comes down to environment and lifestyle, and that really, really starts, preconception and, prenatally.
That's amazing, honestly. But how would you say functional medicine is different than like conventional medicine or conventional pediatrics specifically?
Yeah, so conventional medicine, conventional pediatrics, you really are going in for a current condition and you're getting treated for that current condition most of the time with medication. Um, Going back to what I was just saying with functional medicine, we're looking at the whole child. We're looking at the full picture. So, when a parent comes to me and there's something specific that their child is experiencing, I want to know their story from before they were born. And then, separate to the story before they were born, obviously, that's very important. I also want to know every single detail of their life today. And that's not just, I want to know what they're eating. I want to know what their breakfast, lunch, dinner, their snacks are. I want to know what they're craving. I want to know what their aversions are. Every little detail of this child's story and history is a piece in the puzzle of figuring out what's going on. So there is a major difference. Uh, we're talking about what medications they've been on since they were born. If a child is born naturally, they are going to have experienced that vaginal canal and all of the good bacteria that mom has through that vaginal canal. Whereas if a child was born C-section, they wouldn't have had any of that coating from the vaginal canal that gives them already immunity from mom. You know what I mean? Is a child breastfed? If a child is breastfed, they're getting passive immunity. If a child isn't breastfed, they didn't get passive immunity. This is every little detail is a piece of the picture as to what is going on currently with that child.
Is this applicable to all kinds of issues that you see in children?
Um, what do you mean by that?
So, for example, the general conditions that we see in kids, like regular fevers, like regular flus.
Yes and no. I think fevers and flus are something that's completely natural. I think we've definitely come to a place where we've started to fear illness. Um, and this is something I hope like we kind of get this message across in our session today that we don't need to fear illness. You know what I mean? We don't need to fear our kids getting sick. Of course, unless it's chronic, and I know we're going to get into that, over the next couple of questions, hopefully. But um, just the environment matters. There's just so many details of a child's life that is going to impact their health in the future. And I think that's where we take a very, very 360 look at every angle of the child's life. I mean, really, I'm asking how much screen time do they have? Um, what does their stool look like? How many times are they going to the bathroom? There's just so much detail that gives us clues into what could be going on. And yes, sometimes it could tell us about why flu and fever are completely normal. But if it's something that's extremely frequent or extremely severe, yeah, there are connections, of course.
Mhm. I think it's so hard for moms not to worry when their child is sick, especially when the anxiety kicks in. You're like, I want to take my daughter and run to the doctor the second I see that she has a slight fever. And then here we're told a lot of the times, like, wait 3 days and then bring her in if she still has a fever and all of that. But going back to like the issues that you see in children, what are the most common issues that you would say you've seen?
Most of the issues I see are there's a lot, honestly. There's a lot of constipation, a lot of reflux, um, a lot of nutrient deficiencies, What else?
Nutrient deficiencies like what?
Iron, zinc, magnesium, calcium, vitamin A. I mean, there's, and we'll again get into why, I know exactly why we're seeing these nutrient deficiencies. Um, and it's because we are unfortunately very quick to give our children antibiotics. Many times their antibiotics are overprescribed. And I think this is something I think, I wish all pediatricians would kind of let parents know how much antibiotics can affect your children. I mean, it can, right off the bat, it can predispose them to autoimmunity. If your child, especially if they've had it within the first 6 months of life, separate to autoimmunity, it can cause so many other issues. Obviously, it can cause the gut dysbiosis, and gut dysbiosis is directly correlated to mental health issues, behavioral issues, sleep disorders. I mean, the list goes on. And this is very, very, I guess, heightened if your child has had frequent antibiotic use within the first 2 years of their life. And these are things that we'll start to see come up starting around age 6, 7, and onwards, you know?
But would you say that there are certain conditions that have to be treated with antibiotics?
Of course, listen, I'll never, ever, ever dispute the fact that antibiotics have life-saving potential. We're abusing the life-saving potential of antibiotics. We're using them, they're overprescribed, we're using preemptively. And honestly, for example, 80% of ear infections will resolve on their own. And my question is, like, are we trying to make the parents comfortable by giving children antibiotics? Can we wait and see a few more days? You're very right. We should be waiting at least 3 days in terms of a fever before running to the doctor. Most of the times, antibiotics are prescribed for viral infections when antibiotics are meant to be for bacterial infections. So there are these little details that I feel, first of all, because of it, we're building antibiotic resistance, right? And if we build antibiotic resistance, that future to me is extremely scary because we don't have new antibiotics in the making. It's not profitable for pharmaceutical companies to make antibiotics, right? They're short-term use. So and antibiotic resistance is spread passively. I think it was a couple years ago, a doctor had told me, never give your daughter Zithromax. It's already, there's resistance to that antibiotic because of how much. And I remember, when my daughter was younger, they would always say Zithromax is out of stock. The children's Zithromax is out of stock. And then I always it kind of blew my mind. So yeah, I would be very conscious and careful as to when, if, and how important it is to in what situations you need to give your child antibiotics. And this, putting all of this aside, I think really the education comes way before. And this is honestly why we came up with Raising Health, right? We wanted to tell moms and parents, don't fear fever. Fever is something that should be celebrated. We had a webinar the other day, or a talk on a summit, and I was trying to explain that I get very excited when Sophia has a fever. I know it's completely opposite, the total opposite of what most people would think when their children have fever. But for me, when she gets a fever, I'm like, yes, the body's doing its thing. The body is fighting her. The mechanism that we have in our bodies to fight infection is a fever. And the higher the fever, the better. You know what I mean? The higher the fever, it means that immune system is strong. That immune system is doing what it needs to do to fight that infection. And 99% of the time, you'll see that the higher the fever, if you don't suppress that fever and you support that fever naturally, you will see that they will come out much stronger. And the next time they get sick, you'll see that they're way more resilient to illness than they were the first time. We're building immunity. This is how we build immunity. And again, going back to fever, right? It's our body's natural response to infection, right? A fever's going at those viral or bacterial cells, and they're killing them by raising the temperature of the body. Um, and of course, most parents, what happens during a fever, right? Your body wants to rest, right? Children want to rest. They kind of want to, they're a little bit tired and exhausted. And what do most parents do? Unfortunately, they give them Panadol, they give them a fever reducer, Brufen, whatever it is. And when that child so deeply, innately needs rest, we're masking those symptoms because we want to see our child up and running and jumping and acting normal. So it is actually keeping them from getting the rest that they need because their body's busy fighting that infection. Their bodies do not need to be up and running. They need to be laying down on the couch. They need to be couch potatoes. So I say this so much. The only thing you ever need to focus on when your kids are sick in terms of is hydration. Make sure they're being very well hydrated, especially during a fever, and make sure they're sleeping, you know?
I read a saying once that the flu without medication will take, the flu with medication takes 7 days to go. The flu without medication takes a week.
Yeah, I mean, I would even say 4 or 5 days, yeah.
So it's pretty much the same. You're just suppressing.
You're suppressing, exactly.
But I am, guilty of rushing to try and see how I can support my daughter, right? Taking her to the doctor, trying to see. Personally, I don't like giving medication a lot. Um, I don't take it a lot. I just try to wait it out. But as a parent, you just want to comfort your kid, right? You want them to feel okay. So if a parent wants to work with you, what does that process sort of looks like?
Well, as we discussed, we do a very, very in-depth intake of the child's life. Um, just to mention, I don't usually work with parents in acute situations in the sense that, if a child has a fever or any of that, I'm all for, of course, the mental, emotional support. At the end of the day, I'm not a doctor, but we work a lot on more chronic issues. So if a parent is seeing very frequent flus, some kids really do catch things almost monthly. So this is where we're talking, this is chronic. And this is where we do that in-depth intake. We go over all the details of the child's life from every aspect, mental, emotional, behavioral, physical. I mean, we're talking about, what's their hair like? What are their nails like? What does their tongue look like? What are their energy levels like? So we go in that in-depth intake form along with the preconception and prenatal history, and most importantly, taking what sort of medications they've been on since birth. And once we do that, I take some time, I look at the case, and we come up with nutrient and diet adjustments, nutritional and diet adjustments. We look at lifestyle adjustments, and if supplementation is necessary, we use that as well. So that's kind of what it looks like if someone were to come in and usually it'll be a chronic issue.
And how can people reach you?
So there is a link on my Instagram for discovery calls,
Mm-hmm.
my Sarah Malky profile. We also have a wealth of information on raising health. And I know I've said this to you so many times, but this is really why we came up with raising health, because we want parents to feel empowered. It's exactly what you're saying. I want to rush to the doctor, but on raising health, we go through so many different things common things that your child will experience, whether it's a hand, foot, and mouth disease, ear infections, a cough, a fall, a bump, a bruise, eczema, diaper rashes. I mean, it's really baby's first foods. We really cover it all. Um, and it's us two moms sharing what we do for our children naturally, holistically. My partner Nat is a homeopath in training, so she really covers the homeopathic side. I cover the diet, lifestyle, and supplementation side. And you get both of those recommendations on almost anything you can imagine your child going through. So we detail how you can support your child at home. And honestly, we also wanted to kind of build a community, a platform where people kind of like what you're doing, where people can come and feel like this is where I can, learn. This is where I can find information. And hopefully, eventually, we'll be putting out ebooks and e-guides on so many different things. We'll be doing lots of webinars and in the near future, taking clients as both a homeopathic and functional perspective if parents need that extra support.
That's amazing. So guys, just in case you're interested in finding out more, we'll add both links in the show notes below. We'll add the link to Sarah's profile and where you can book a discovery call. And we'll also add the link to Raising Health 101, where you can get your hands on the guide that Sarah mentioned. I know it's very helpful, especially now coming from a mom who just sent her daughter to, school in flu season. So we'll add the links to the show notes below. Okay, so we mentioned a few things. You mentioned sleep struggles, you mentioned gut issues, you mentioned eczema. How are all of these connected?
Well, I love that question, Nour, because they are very much all connected and it all really comes back to gut health, you know? Very, very sadly and unfortunately, I haven't had a single client come to me that has, you know, their child hasn't had the bare minimum of 2 to 3 antibiotics a year given to them. Most of the time, unnecessarily. Many times for viral infections, which really still remains to be confusing for me because obviously antibiotics are for bacterial infections. So all of these things are very, very, very interconnected in terms of gut health. That's where really I would say almost 100% of the time that would be the root cause.
hmm And I think also in a lot of countries, the distribution of antibiotics is not controlled. So you can go to the pharmacy and you can just give them the name of an antibiotics and they will give it to you, right? But if you were to give parents sort of some tips on, you know, what are like some conditions that don't appear to need antibiotics from the get-go, what would those be?
Well, honestly, the number one thing I tell parents to do is wait and see. My for clients that usually come to me, and let's say, their child has a fever or they'll tell me, whatever, the throat is so red, I'm sure it's this or that. The first thing I tell them to do is, first of all, just wait a few days. We're very, very quick again, and this is where I want parents to kind of step out of that. This isn't about you. I know you're worried for your child, but it's not about your comfort and your relieving yourself of worry. And number two, believe in the body's intelligence. These are children are pristine beings. They're born fresh. They're fresh. They're fresh out of the oven. Their bodies will respond way more effectively than ours. They don't have as high of a toxic burden that we have. You know, they're almost perfect. Let's try and keep that intact by supporting their body's intelligence in responding rather than suppressing with medication. So I think my number one recommendation to parents would be just wait and see. Another one would be, if you're extremely worried, you notice that your child is getting worse, they're not getting better, go to the doctor. Intuitively, a mom knows when she needs to go to the doctor. Ask for a blood test to confirm if it's bacterial or viral. Ask for a swab. I know a lot of pediatricians will recommend antibiotics for throat infections before taking a swab to making sure whether it's viral or bacterial. So these are very simple things, and this again, we want to empower parents to going to the doctor and asking those questions. Advocate for your child.
Yeah.
You know what I mean? You don't.
no one is a know-it-all. And I think it was Dr. Joel Gator, who's a functional pediatric doctor, who had said, mother's intuition is a clinical tool, and let's use that. And I thought that was so powerful because, if we use mother's intuition and we know when something is right or not right with our kids, and we speak up if the doctor tells us your kid needs antibiotics, you have every right to ask for a swab. You have every right to ask for a blood test to confirm. Don't be shy. Don't you're doing the right thing for your child by advocating for them in that way. I think advocacy in general, even advocating for yourself as a mom, right, from the delivery room to beyond is difficult, but it's platforms like these, right, Madinat Mom and Raising Health, that are providing parents with education and tools and information that you can use when advocating for yourself. And if you were to talk about some natural changes or simple changes that parents can do from the household, what would those be? Okay, there's a lot. I don't want to overwhelm anybody, but I think number one is trying to reduce our toxic load. We are in an area of the world, a region of the world where our air quality isn't that great. One of my number one recommendations is get an air purifier for the house in the bedrooms overnight, especially for the younger infants and children. Um, Make sure your water is filtered and mineralized. Test your water if you need to. These are basics. The air we're breathing, the water we're drinking. Um, what's another one? Speaking of toxic burden and exposures, I always say food first, and food is medicine, nutrition first. So a nutrient dense diet, but also looking at making sure that the foods you choose aren't heavily sprayed with pesticides. And we go over that as well in Raising Health, where we cover the annual Dirty Dozen and Clean 15 to kind of give parents that, like, I know it's not cheap to buy everything organic, of course not, but, it gives you a good idea of what kind of things are more heavily sprayed with pesticides that you can try and avoid, and buy those organic, and the other things non-organic, and it's fine because they're not as heavily sprayed. What else is there? Really going back to basics at home with, like, sleep hygiene. I do I had a client the other day who told me that, to help her kids unwind, they do screen time before bed. Um, and that is not a way for children to unwind. You're giving your kids the opposite of unwinding. When you give them screen time, you're giving their bodies and their eyes blue light from that screen, which is telling their bodies that it's midday. So instead of having quality deep sleep, these children are probably more hyperactive at night. They're not getting good deep sleep, and sleep is medicine, right? Sleep is when we detox. Sleep is when we recover. Sleep is when we repair. It's like the number one thing I tell my daughter whenever she says she's not feeling well. I always tell her, let's try to sleep it off. I'm like, why should we sleep it off? And she says, because sleep is medicine, and genuinely sleep is medicine. And this goes for adolescents as well. This is for teenagers. A lot of us think, okay, yes, teenagers like to stay up late and go out at night, but sleep hygiene is even more important for them. This is the period where their brains are developing the most, and sleep is where the sleep disorders and sleep disruption is directly correlated to behavioral issues, ADHD, even appetite regulation, and blood sugar balance. We don't get good sleep, we're going to feel hungrier and for the wrong things. I know that we experience it as adults. It's the same for children. Movement, and being outdoors. Sunlight is medicine. Get your kids out in the sun. Movement is moving the lymphatic system. Moving the lymphatic system is circulating the immune cells throughout the body. So we don't want kids to be at home and on their screens. We want as much outdoor physical movement as possible. Hydration is another one. Keeping up hydration, making sure your kids are very well hydrated. All of these things are really important. So I guess my recommendation would be start with the basics.
start with the basics. What are you putting in your body, in your direct environment? Oh, another thing is EMFs, right? So make sure you don't have routers anywhere near your child's bedroom if you can, and if it's possible, turn off Wi-Fi overnight. EMFs are electromagnetic fields that are affecting our children's brain, especially because they are still developing and growing. So these are things that I feel like could be small, easier, basic steps that we can start to look at that affect our kids' health in terms of just everyday life. That's where it starts, lifestyle.
So, Sarah, I have to tell you, like, as a mom of two, I think the one thing that's always on my mind, and it makes me so nervous, is my daughter bringing home something that could potentially make my son sick, right? So, when I go to the doctor, right? When my daughter is sick and I go to the doctor, what are some questions that I need to be asking before giving her the medication that they would usually recommend?
Um, so I have three off the top of my head that I think are super powerful and important in the sense, and this was something actually that I really wish I had asked that question, or I may have even asked that question the first time my daughter was on antibiotics at 3 years old. She had a cough. And I remember going into the pediatrician's office and we're checking it, and she kind of knew I was like anti giving any unnecessary medication. And she tells me like she needs antibiotics. And I tell her, well, isn't there anything else I can do? Like, before, can't we leave that kind of as a last resort? Is there anything else I can do? Is there like a cough syrup? Is there, and she was like, no, 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 you can wait 7 more days. Okay, fine. I later realized that there were other options that as a first time mom, luckily I hadn't ever had to take my daughter in to the pediatrician's office when she was sick. Um, Although she had been sick before, but um, I knew there were options like steroids. I didn't know that at the time. And looking back, I feel like we could have tried that before moving on to antibiotics and instead of waiting 7 days, for example. So I feel like, there is that question of knowing all your options, or at least asking the doctor, what are all my options currently in this situation? Is there an alternative? Is there something I could try at home? That's maybe the first question off the top of my head. A second one would be, um, what would happen if we wait and monitor this? Is this something we can wait and see? And I think this is especially true for ear infections. Ear infections are the biggest reason antibiotics are overprescribed. So, and 80% of the time, they do not need antibiotics. They will resolve on their own. Um, so in that case, yes, I know we don't want to see our kids in pain. Um, and so people, again, it's that idea of the parents feeling like, oh, my daughter's in pain, I need to help them. But a lot of the times, if you wait a few more days, with supporting natural remedies at home that can help soothe the pain, they may not need antibiotics really 80% of the time. The last question I think would be, I think I had mentioned this earlier, is asking for lab work. If your doctor does prescribe antibiotics and you don't feel 100% sure about it, or you want to know if it's 100% a bacterial issue, you can ask for lab work. You can ask for a throat swab if it's a throat. You can ask for a blood test just to confirm that antibiotics is the right course of action.
So, Sarah, you touched on natural remedies, and can you tell us what are some of those natural remedies? But more specifically, if we talk about nutrition and how parents can introduce healthy eating from an earlier age, what would those be?
Actually, I love that you brought up this question, Nour, because I think this, I say it to every client. I think I'll say it till the day I die. Nutrition first, food first, and nutrition is everything. Food is medicine. Food really is nutrition first, and food is medicine.
And the reason I say this is because of a lot of what I see. Um, it starts to feel like kids become in this catch-22 situation. Okay, so let's say a child has had antibiotics early on. Um, because of the antibiotics, they get gut dysbiosis. This gut dysbiosis causes malabsorption of very key and essential nutrients that keep them from getting sick. So let's take zinc, for example. Zinc is highly immunoregulatory. It's really important for immune function. It regulates our appetite. In fact, it regulates our appetite, our smell, our taste, and it's very directly linked to protein intake. Um, it also has a lot to do with how well your children are going to heal from eczema or diaper rashes or um, hair thinning or brittle nails. Zinc is an extremely important nutrient that is very, very affected by antibiotic intake. Okay, so if that zinc is low, your child, you will notice there is picky eating, maybe slow eating, maybe sensory issues. So you start to adapt to that child's eating when really what they need more of, and I see this so often. One of the two main is zinc and iron, and there's such a lack of those foods in children's diet. We're talking feeding your kids meat, chicken, poultry, like all of these foods that are rich in zinc and B vitamins and iron that will keep them from getting sick. I mean, what else is low zinc correlated with more frequent and more severe respiratory infections in babies and children? So these are deficiencies that can be avoided with early nutrition in terms of making sure your baby's first foods are things like a bone broth or a meat stock. Um, and my number one recommendation in terms of nutrition, I just had someone ask me yesterday, what multivitamin do you give your child? I give her liver. That's her multivitamin. It's nature's multivitamin. It's high in zinc. It's high in iron. It's high in B vitamins. It's high in vitamin A. All of these nutrients. It's high in magnesium. It's high in vitamin D. All of these nutrients that keep our kids from getting sick repetitively. So now, where is the issue? The issue is with all of these children that have had several rounds of antibiotics. They now have malabsorption. They're not absorbing their zinc. They're not absorbing their vitamin A. They're not absorbing iron. And this is where we start to see focus issues, ADHD, attention, even emotional issues and behavioral issues. We start to see eczema. We start to see all of these different things. And again, it comes down to if it is affecting appetite regulation. You're going to think your child is not eating well. They don't eat much. They like the same foods over and over again. That's because their zinc is low. They have attention and focus issues. My child has a shadow at school. Well, I went to the pediatrician and they told me his iron is low. Direct correlation. So I'm so glad you brought that up because really nutrition comes first. And again, food is medicine. So making sure we include those foods in our kids' diet. And there's so many ways to bring those in. I always tell my clients, if your kid doesn't like the taste of liver, open up a liver capsule. Open up a liver capsule, put it in the soup, put it in their main meals, put it in a smoothie. It's virtually tasteless. You know what I mean? You could take frozen liver and shave frozen liver into their soups, their smoothies, whatever it is. And that has by far one of the biggest effects over anything else that I could recommend.
I was actually going to ask you about supplements,
Yeah.
but you touched on that. So you would recommend
Yeah.
food first.
Food first.
Yeah.
Food first, but of course, that's obviously given the child's situation. If a child has a malabsorption, they are going to need extra support through supplementation. If a child has had antibiotics even once in their lives, it takes up to 2 years to rebuild that good gut bacteria. And the amazing thing is that kids are so resilient and they respond so quickly. So if parents, if we knew, even if pediatricians told you, hey, you know what, your child is on antibiotics, you need to take specific strains of probiotics to help keep those good bacteria intact so it doesn't wipe everything out. There is a lot of missing that missing piece in terms of children's health when they do have to go on medication because it is a part of life. They need to sometimes go on medication. They need to sometimes take antibiotics. It's what you do after. We can rebuild. There is that opportunity, and they respond so much faster than we do as adults. So I think that's a big part of it. I mean, so much good stuff. I know we could go on and on.
Yeah.
There's so much to cover, but um, I want to move on to a lightning round where we're gonna cover a few, I think, essential questions that where parents are dying to know about. The first one is your go-to natural remedy for a cold. For cold and group it together, cold and flu. Okay, I'm gonna obviously start with nutrition because nutrition first. I love these traditional healing foods, traditional healing warming foods and spices. So we're looking at like your grandma's chicken soup, you're looking at bone broth, add in the turmeric, add in the ginger, add in that garlic, all of these antiviral, antibacterial, antimicrobial compounds that can really, really help the body. Um, what else? I really love herbal teas. I'm lucky that my daughter is a big fan of them. We kind of have our little tea time together, but I love herbal teas. For example, if your child has a fever, and they're feeling very hot, peppermint is very cooling. If they're feeling cold, either feeling cold and chilly while they have a fever, cinnamon is really warming. Marshmallow root is very comforting. Chamomile, um, really the list is endless. What else can we move on to? In terms of supplements and still on the note of herbs, I love elderberry. Elderberry is great in terms of antiviral compounds and stopping the virus from proliferating. I love, love, love black seed oil. I love black seed oil. I actually try and give it preemptively around 6th season. Um, so that's something parents can do. And then kind of in terms of like, the things we would do at home, uh, physically is the first thing I would do if I feel like my daughter's coming down with something. I put her in something called an Epsom salt bath. This is upping her magnesium because we absorb magnesium transdermally. That's the best way for absorbing magnesium. It's a great way to detox. It's a great way to relieve congestion. And you can add in, a couple drops of peppermint oil. Of course, depending on whether your child has a fever or not, you want to watch out with the temperature of the water. But I love, love, love an Epsom salt bath. I also love a sinus rinse, nasal spray. Those are my go-to, definitely for cold and flu. And I think the last one would be a couple of things. I love castor oil packs for really helping the body through that detoxification. And even a sinus massage with the castor oil, really, really helpful for younger children and babies because they're not able to clear, they're not able to blow their nose. So helping them with that castor oil massage around their ears and getting that lymph moving in the face and clearing out, thinning the mucus. Or a castor oil liver pack as well. They have the children's size castor oil liver pack, which is amazing. And then sometimes I do use red light therapy, which I love. It's really great for reducing inflammation. Um, I think those would be my top. Yeah. And I know you have a little surprise for us, but I'll tell everybody, you guys don't have to write this down. Sarah prepared a freebie for us. That's Sarah Melki's go-to cold and flu remedies. And we will put the link below so that you can download it. And ahead flu season, I know that we're all going to want to get to that list and start implementing everything that you just talked about. Do they work as
preventive measures?
They do, yeah. You can definitely do these things. I don't like supplementation permanently. I mean, I don't think that, again, we're not meant to give our kids supplementation all the time or all year round. It definitely can work preventively right around, either if it's back to school, right around that seasonal change. I mean, you can also feel that off your children. Usually, you can feel they're getting extra clingy or nagging, or I always know, or they had a bad night's sleep. You can always kind of tell when something's coming up.
Mm-hmm. Great. Yeah, so definitely grab that freebie while we have it on. And the next question of the lightning round is, what's in your kitchen? What's in your wellness cabinet?
Okay, that's a long list. Um, but the great thing is, actually, our first ebook for raising health is it's called A Holistic Family's Natural Medicine Cabinet. And in there we have over 48 things, remedies to have at home and on hand for almost anything you can think of, like uh, general immune support, general everyday support, tummy bugs, diaper rash, skin issues, bump, bruise, a fall. Um, we go over so many things that you would experience: cough, cold. There is so much in there. So we have homeopathic remedies in there, as well as different supplements and remedies you can use for all of these different things. So I guess I would encourage people to try and wait for that. We'll be releasing it very soon. But it would really, really make you feel very prepared at home. Um, and honestly make you feel very confident to know that you have exactly what you need right at home when your kid wakes up in the middle of the night and you're not sure what to do, you know?
If you could give us like a little sneak peek of a couple of things that you have on there.
Okay, so for ear infections, I love garlic mullein oil. As long as your child eardrum is not perforated, the garlic is antiviral, antibacterial, and the mullein is very soothing for the ear. So it soothes that pain. Another thing on there, a great one for tummy bugs, is charcoal. Charcoal is like that kind of the one that you take with you everywhere when you're traveling, just in case food poisoning, a tummy bug. What else do we have in there? I mean, we also go through all of the dosages based on age, which is amazing as well. So people can kind of, I think that's sometimes the tough part when it comes to supplementation, is it may not be very obvious. Oh, okay, but my baby's so small. Do I give them the same dose as the toddler, and so on and so forth? What else do we have in there? I think we have the elderberry, we have the black seed oil, we have, the colloidal silver for as a skin spray. Um, there's a lot. There's a lot in there.
The next question, which I love, and I want to hear this one, but what's one unhealthy thing you still do that you know you should not be doing?
It's gonna sound really silly, I feel, but I really love TV shows, and it's always like thrillers or like things that really like make your anxiety, like I'm always sitting at the edge of the couch and it's right before I sleep. That's exactly the opposite of what I should be doing right before I sleep. And I'll miss out on some sleep to sort of watch one more episode. I think that's probably my biggest vice.
I mean, I think we've all been guilty of that. I'm not doing that now because I think I can just I want to soak up any minute of sleep that I can get. But we've I've been there. I know what you mean. I don't love thrillers though. I don't watch thrillers. I like them. I don't like them. I like calm shows, happy shows. I feel that makes me relax. Yeah, I could send you a list of a few ones I love. Please do. But this episode, I think, was just filled with so much goodness, so much value, so many takeaways. And if we were to end it with some advice that you can give for parents that are listening, that all of us go through it, our kids get sick on a regular basis. It's the season, it's the daycare, it's this, it's that. What advice would you give? And if you like, you can give it to the main camera.
Sure. I guess I would say
don't be afraid to advocate for your child's health. Do ask questions. Do trust in the body's intelligence. Do shift your mindset to supporting rather than suppressing. And I think most importantly, don't let this session make you feel guilty for what's happened in the past. I hope that, this episode kind of gives you this motivation to take action moving forward. Our kids are resilient. Our kids do recover. Our kids do bounce back, regardless of having taken medication or taken antibiotics. They respond so much faster. And that's the amazing thing, is they respond so much faster to however we can help them more than we do. So
That was perfect. Thank you so much. I'm actually going to keep my outro super short. This was amazing. Thank you for all of the information that you gave us. Thank you for sharing your story as well. If you guys didn't watch part one, make sure to go ahead and watch that. If you like this episode, please make sure to hit that subscribe button, hit that like button, share it with a mama friend that you know will appreciate and love the episode as much as we loved making it. And you know that if you have a story of your own to share, you can always share it with me. You can find me on contact@madinatmom.com, on www.madinatmom.com, or on our Instagram, Madinat Mom. And until next time, make sure to take care of yourselves as fiercely as you take care of your little ones.